Hello, this is Dr. Blair Masters with Arkansas Physical Health and Rehab, and today I wanted to talk to you about disc correction therapy, or what we call DCT non-surgical. This is a revolutionary treatment that can save a person from back surgery. Back problems can result in really extreme pain and disability. It's a leading cause, second leading cause of missed work. Flare-ups tend to be what they call self-limiting. In other words, if you just sit around, they tend to go away. But back problems, if you do that, become chronic and they come back time after time after time. And really, it's a big problem. 80% of people are struck with disabling spine pain at some point in their lives. And in the United States of America, there's over 500 people every day that are permanently disabled due to back problems. With this slide, we have a normal disc. You can see the red part in the center is what they call a nucleus fibrosis, and the blue part around the outside are the annular fibers, and this helps keep the nucleus where it should be. There's no pinched nerves, the alignment's in really good shape, no problems. Here is a disc herniation, and this particular type is what's called a central disc herniation. It's going back in the center, and you can see it's pinching on the spinal cord itself, which is the most serious kind of disc problem you can have. And sometimes this actually even requires emergency surgery. Thank heavens, though, this is not a very common type. This one is a much more common type, and you can see the nucleus, the disc, is pinching or bulging off to the right-hand side. This is far more common, and it's pinching the nerve going down one side versus both sides like the previous slide. This is the kind of thing that oftentimes we get extremely good results with when it comes to using disc correction therapy. Now, DCT non-surgical or disc correction therapy is a progressive combination of treatments that can help correct bulging, herniated, and degenerative discs without surgery. We developed it in combination of the best proven therapies that's been shown to work together to improve both cervical or lumbar disc problems, and we're the only people in Northwest Arkansas that have it. There's a couple of requirements of our patients with this. They have to have a bulging, herniated, or degenerative disc, facet syndrome, sciatica, which is a pain down the leg, degenerative joint disease or degenerative disc disease, or spinal stenosis. They need to have no free-floating fragment, and if you've had an MRI, that's a possibility that you know what that is, and know what they call a spondylolisthesis, which is actually a cracked bone in the back. Another requirement that we have is that we require our patients to really have a commitment to the process, because it is very important when you start this that you keep your appointments and stay on task with getting the problem taken care of. What does DCT non-surgical actually do? It consists of a number of therapies. There's decompression therapy that actually creates a negative pressure within the disc, and it helps suck the disc material back in. Now, when we've pulled on the discs and gotten this negative pressure, sometimes it creates a little bit of soreness, so we use interferential and cryotherapy, and this helps decrease the pain, swelling, and spasm. We also do neuromuscular reeducation and rehabilitation exercises. These help rehabilitate and strengthen the muscles of the spine and get them working properly. We also perform chiropractic adjustments. This helps realign the spinal vertebra, and if someone's in a lot of pain, we can do acupuncture to help get relief as well. There are a number of disadvantages to surgery. It's an invasive procedure. There's always a risk when you cut someone open. Failed back surgery syndrome is up to 48% of the cases. Failed back surgery is when you're in as bad or worse pain after the surgery as you were before. 27% of people who've had back surgery require a repeat surgery, and almost 70% of the repeat surgeries result in permanent disability. There's a lot of side effects to surgery that can occur: adhesion, scar tissue, secondary infection, nerve damage. All of these things can cause continued pain. Usually you have a fairly long recovery time, 6 to 8 weeks, and according to the American Medical Association, there's an automatic 10% disability anytime you've had back surgery. The advantages of DCT non-surgical are many as well. It's a non-invasive procedure, 86% effective, there's rapid return to work times, and depending on your work, you may even not have to take off any days. There's no side effects and no long-term consequences. It's an outpatient procedure, and it's inherently safe. It really is extremely safe. Why is DCT so effective? There were a couple of medical doctors, Dr. Leroy and Sheely, and they found that there were a number of factors that had to be in place for this type of therapy to be effective. A split table, knee flexion, controlled flexion of the lumbar spine, non-slippage of the lumbar and chest harnesses, the use of electrical stim, heat or ice, and strengthening and stabilizing exercises. And because of their research, we have all of these things in DCT non-surgical. We have a number of advantages here at Arkansas Physical Health and Rehab too. Chiropractic care, we have a state-of-the-art rehabilitation program, acupuncture if required, nutrition and herbal therapies that help speed up your healing, muscle testing for diagnosis. We bill insurance for you, and if you have been here before, you know we have the friendliest staff in town. This is a picture of a patient who got DCT in the neck area. On the left-hand side, and you can see the date, October 7th of 2009, the patient had an MRI and her disc about midway down her neck area is bulging out, and you can see it's pinching on the spinal cord. This next picture was April 19th of 2010 after we did disc correction therapy, and you can see the disc is sucked back into place. There's no more pinching on the spinal cord. This patient was able to avoid surgery after she went through this procedure and was extremely happy. The radiologist, when he saw this, said, "Wow, I can't believe that." What's your next step? DCT really is not for everyone, but if it does sound right for you, make an appointment today to receive your comprehensive examination to find out if you qualify for disc correction therapy. Follow through the recommended treatment plan, and we are here to help you every step of the way. Because you're looking at this presentation, we're going to make you a special offer. If you call and make an appointment today, you get an in-depth consultation, a free examination, and any needed x-rays to find out if your back pain will respond to disc correction therapy, and that's all at no charge. But you've got to make an appointment today. We have events in the future, and those appointments are reserved for those attendees. If you're suffering now is the best time to get it taken care of. And really, things only get worse if you do nothing. So call Sonia today at 479-443-0800 to make an appointment. Here's our contact information in case you missed that. We're located at 1583 Main Drive in Fayetteville. That's just to the west of Golden Corral, past the Sonic. You can see our website there. Best Fayetteville chiropractor. I was voted the best chiropractor in Northwest Arkansas 4 years in a row. And again, our telephone number, 443-0800. Thanks very much for listening, and call us, and we'll see if we can help you.